Ever wake up with a finger that's locked in place? Feels like it's stuck and won't straighten? You might have trigger finger. And I'm here to show you how to fix it. Hi, I'm Dr. Ram Kumarao, the bone doctor, and you're watching the Ortho Insider. Trigger finger happens when the tendons in your hands get thick and inflamed, making it hard to glide smoothly. This leads to pain, stiffness, clicking or locking sensation when you try to move your fingers. So, who's at risk? Those performing repetitive gripping, those with diabetes, those with rheumatoid arthritis, those above 40, and females. If you fall into any of these categories, your fingers might be at risk. So, what are the symptoms of trigger finger? Clicking or popping sensation, pain and stiffness especially in the mornings, fingers getting stuck in a bent position. If this sounds familiar, don't worry, there are ways to fix it. Here are simple home exercises to fix trigger finger. Finger extensions, tendon gliding, rubber band stretching, massage and ice therapy. Do these exercises daily to keep your fingers moving smoothly. If your symptoms persist, treatments include splinting, steroid injections, and surgery. Surgery is done in severe cases where a simple daycare procedure can help free your tendons. Got a stiff finger? Start these exercises today. Like, share, and follow for more orthopedic tips. Thank you.